So Navigate is an evidence-based coordinated specialty care program that is designed to provide comprehensive care for youth and their families in the context of a first episode of psychosis. So Navigate includes a number of components that are sort of brought together in a coordinated fashion to ensure that all individuals who are presenting to a service for treatment of an early episode of psychosis receive the same comprehensive care. One of the components of Navigate is a family intervention or family education program that really focuses on enabling the families to be able to support their loved ones during that early journey in their treatment for an early episode of psychosis. There's also other components to Navigate as well. So there's, of course, a prescriber who oversees the individualized medication treatment. There's an individual resiliency trainer who provides some focused resiliency support, psychoeducation, and a strengths-based approach to enable youth to identify their goals, set their goals, and move forward in their recovery from a first episode of psychosis. There's, in addition, a supported employment and education specialist whose purpose is really to work closely with the youth early on in the course of treatment in identifying and working towards education and work-based goals. From youth, for example, to identify things like their strengths, resilience factors, their support networks, their goals, and utilizing that information to then shape the kinds of things that we're focusing on in treatment. Because the goal ultimately of Navigate is to enable an individual's recovery and to leverage the strengths and the resilience that we know they bring from the outset to achieve those goals. Navigate is intended for the delivery of care to individuals who are living in the community, and not necessarily for inpatient treatment, often because the goals of inpatient treatment are much more focused on ensuring that the individual is better and rapidly recovering from an episode of psychosis and able to return back to their home in the community where they then can continue to work on their recovery pieces of their journey. So one of the exciting things I would say about Navigate is the foundational framework that it provides for the consistent delivery of care for all patients and their families, regardless of where they're being seen, who is seeing them, that we know that they are receiving the same high-quality evidence-based care. And that's consistent with feedback that we've received from patients and their families as well, that part of what they appreciate with Navigate is not only the intentional nature and the sort of continuous growth that happens through their receipt of Navigate care, but also knowing that other people across the province, regardless of where they're being treated, are able to have the same consistent care. And that has been incredibly exciting. One thing that we've seen as we've gone through this implementation is that the content matches the kinds of things that we want to be engaging our patients around, the type of psychoeducation we want to be providing to our patients and to their families, and provides an evidence-based structure through which to deliver that care.